Years ago, I saw a patient with a toe wound that looked off. Cool skin, purple tint, not infected, but not healing either. I pulled out the handheld Doppler, turned it on, placed the probe, and heard one long, weak swoosh. That's when I knew this wasn't just a wound. This was poor blood flow. And if we hadn't caught it, that toe could have been lost. For those who don't know me, my name is Dr. Voltaire, a wound care physician. And today I'm going to show you how to use a handheld Doppler, how to understand triphasic, biphasic, and monophasic waveforms, and how Doppler fits beautifully with ABI readings to give you the whole vascular picture. Here's the truth. Wounds don't heal without blood flow. You can use the best dressings, the most advanced therapies, but if blood isn't getting there, nothing works. That's why using a Doppler is one of the most important things you can do before choosing compression or sharp debridement. And the best part is that it's cheap, fast, and you can learn it in 10 minutes. You're not just listening for sound, you're listening for rhythm, for strength, for how the vessel behaves. That's where triphasic, biphasic, and monophasic come in. Okay, let's break it down. Imagine blood flowing through a healthy artery. It pulses, then briefly reverses, then pulses forward again. That's triphasic, a strong, resilient wave. Triphasic is normal. You'll hear 3 sounds. It's crisp, it snaps. Think of it like a drum beat. A biphasic sound is slightly less healthy. You'll hear 2 phases, still okay, but maybe early disease. Monophasic is not good. You'll hear 1 weak, prolonged sound. It's dull and drawn out, like a breath that never fully exhales. Monophasic flow means there's significant narrowing or blockage. This patient might need vascular referral ASAP. Studies show that triphasic waveforms are a strong predictor of normal ABI values, while monophasic waveforms often correlate with ABIs of less than 0.5, which suggests severe arterial disease. Now, if you're not familiar with ABI, that's okay. ABI stands for Ankle Brachial Index. It's a quick, non-invasive test that compares the blood pressure at the ankle to the blood pressure in the arm. If the pressure at the ankle is lower, that tells us there may be reduced blood flow to the legs and feet, which means wounds in those areas may not heal well without help. ABI of 1 or more is normal, 0.8 to 0.9 is mild disease, 0.5 to 0.8 is moderate, and below 0.5 is severe arterial disease. So ABI gives you the numbers, Doppler gives you the sound and the shape. Together, they help you truly understand what's happening under the surface. Even if the ABI looks borderline, the Doppler can pick up things ABI alone misses. And in patients with diabetes or kidney disease, ABI results can be falsely high, so the Doppler fills in the blanks. Here's how to use a handheld Doppler step by step. You first apply gel to the skin over the artery, either the dorsalis pedis or posterior tibialis. Then you hold the probe at a 45 to 60 degree angle, not flat, not straight down. Move slowly until you hear a strong signal. Listen to the rhythm, then compare it bilaterally. Don't just say pulse is present. You should say triphasic flow dorsalis pedis bilaterally. That's real documentation. Now, if you're thinking, how do I remember what these sounds mean or how to chart it? Well, I made a simple Doppler quick guide. It includes audio waves, examples, waveform sketches, and what they each mean clinically. You'll find it inside the WoundFit community under Doppler and ABI Toolkit in the resources section. It's there to help you feel confident even if you've never used a Doppler before. And here's a pro tip from that guide. If you hear a monophasic signal, don't compress until you get vascular clearance. So how does Doppler fit with ABI? Think of ABI as the math, the numbers. And think of Doppler as the music, the sound of how blood is flowing. If you want to improve wound healing, you have to improve your vascular assessment. And the Doppler is one of the most powerful tools we have. So learn to recognize the sounds. Don't be afraid of using it. It's simple with practice and it matters. And always remember that healing requires blood flow. Thanks for watching. If you liked this video, check out my next one where I discuss the dangers of poor blood flow. Stay informed and heal well.